It is true that it is more difficult to have a natural birth in the hospital. Now, it's more than just the fact that we have medications in the hospital and an anesthesiologist. Today, I want to give you a few tips to getting your natural or unmedicated birth at the hospital. As a labor and delivery nurse who's seen thousands of patients give birth in the hospital, and yes, at my first hospital, the majority of patients went unmedicated, I'm excited to give you guys some tips. Okay, first off, what is natural birth? I hear that thrown around a lot. Some people mean that they're not getting induced. Some people mean that they're not having pain medication. Some people mean that it is not a C-section. So it can be really confusing. In this video, we're going to talk about giving birth in the hospital without pain meds. That is what natural means today in this video. Most often, I will refer to that as unmedicated birth. Side note, most births get some medication, so it's still not like just unmedicated. And first off, I want to clear up the myth, which I see a lot online where people are saying, oh, you can give birth without any pain at all. And I am here to tell you that most people feel some pain. A fair amount of pain. Then I'll hear them later say, oh, I had no pain with it at all. And I'm thinking, girl, you seemed like you were in a lot of pain a couple hours ago. So there is a lot that our brain does to kind of help us forget what labor feels like. But I'm also here to tell you that the majority of people are going to feel a good amount of pain associated with birth. I'm not here to say that you need to be afraid of that, but I want you to be realistic about what you're confronting going into birth. And if you're wondering what the heck do contractions feel like, I actually have a whole video about that. I'm going to link that down below. Honestly, I'm super glad that you're even thinking about all of this because it is really easy to just kind of like shut all of this out or not make choices about your upcoming birth. But I totally recommend that people at least go through a birth plan to start thinking about the options that they're going to have during birth. I have a free mini class called Birth Plans Made Easy that helps you go through it along with me. I'll put the link down below. Okay, so you're in the hospital, you would like to not use pain management. My first tip is to not get induced. Now, of course, this doesn't work for everybody. Maybe your blood pressure is super high or the baby's not growing as well and you need to get induced. I have definitely seen patients who did a lot of preparation and did not need pain management with an induction of labor. But most often, people who are getting induced end up wanting an epidural because of the length of time that an induction takes. They just end up getting tired, and an epidural can be a great way to get some rest. So if you can avoid an induction, if you want to have an unmedicated birth, I think that's your best bet. But I want you to look at it this way. If baby really needs to come out and you end up needing to get an epidural through that, it's going to be fine. I am here to tell you that epidurals have been proven to be safe. There can be risks with anything in the hospital, but I don't want you to come in thinking epidurals are absolutely horrible. I don't think that's a great mindset to be in either. And while we are here, there are actually things that you can do to prepare your cervix starting about 36 weeks of pregnancy. I have a whole video on it. I'm going to put the link down below, but I think that's one way that you might end up getting an easier induction, which means you're less likely to need pain management. And nobody talks about those things. So I'm excited for you guys to check out that video. Okay, my next tip is to labor as long as you can at home. Now, at home, you don't have an epidural, so that's one way to not get an epidural. But being at home, you have your bed and your pillows and your things, and you can eat brownies whenever the heck you want. Versus when you come into the hospital, things are just more restrictive. We want to have the baby on the monitor. Our beds are absolutely not the best beds. There's no Tempur-Pedic mattresses in the hospital. Things are just more uncomfortable. Plus, I gotta say, the hospital is just not a comfortable place. You have strangers coming in and out of your room. It's just so much more comfortable at home. So the more time you can spend at home, the better. Most people believe that the best place for you in early labor is to be at your house, as long as there aren't any conflicts or things going on. And then when you get into active labor, which is usually 4 to 6 centimeters, that's the time to head into the hospital. Now, a lot of you might be thinking, I'm going to deliver my baby in the car. Are you interested in a video on precipitous birth or fast labors? Tell me down in the comments. I'd love to make it if there is an interest. Okay, my third tip is to do something about it ahead of time. I think a lot of people are just thinking my fortitude is going to get me through this labor. I've had painful period cramps before. I'm going to be just fine with this. And I am here to tell you that I have seen so many patients come in with that attitude who did no real preparation at all, and then they end up getting an epidural. Now, I'm not here to say that getting an epidural is bad. I got an epidural. But if you really want to try for an unmedicated birth, you need to do some preparation for yourself ahead of time. The online prenatal class for couples has a whole natural pain management video. It is the class I recommend for you to get prepared for an unmedicated birth. I'm going to put the link down below. There are other great options also like hypnobirthing that just focus on pain, but I am here to also tell you that sometimes some of the pain of labor is the unknown and all these things that we're doing and the choices that you have to make. So getting a well-rounded class that discusses natural pain management along with making choices during labor is really important. That's why I recommend that class. But something like hypnobabies can be a great addition. I've seen people have a lot of success with that. Okay, my fourth tip is to hire a doula. The reality is managing pain doesn't come naturally to a lot of us. A lot of us, when we get in pain, we stop thinking about all of our options and the things that we could be doing to manage that pain. So hiring a doula can be a really helpful thing. It may not be in the budget for everyone, but I am noticing more and more insurances are covering doulas. So it can be something to think about. I am not sure about the pricing for a doula in your area, so it might be something to check out if an unmedicated birth is really important to you. I'm also here to say that some people are not able to get an epidural, maybe your platelets or something with your spine. And in those cases, I think it would also be awesome to check out a doula to help you manage the pain of labor since you will not be able to get an epidural. And by the way, the fact that insurance would cover an anesthesiologist and not a doula in those cases is absolutely insane. I'm with you on that. My next tip is to be upfront with your nurse about what you want. A lot of times in our intake questionnaire, we'll ask you what your pain management plans are. And I think it's important to tell your nurse that you've prepared and you really want to try for an unmedicated birth. And I think another pro tip can be, and I would prefer that you not ask me if I want anything for pain. I will ask if I need it. At that point in time, it is likely that your nurse is just going to educate you about the things that are available, nitrous oxide, IV pain medication, or an epidural, so that she can just check that box that she's done it. And then she can kind of leave you alone, because we are required in the hospital to ask you every certain number of minutes how you are coping with your pain. And unless the patient says, please don't do that, I don't want to be asked, we are required to do that. As you can imagine, on a med-surg floor, we of course want to make sure that we're taking care of people's pain. And for some reason, we also have to do it in labor and delivery. So that can be a pro tip, to let your nurse know that you don't want to be asked or offered anything, but you will let them know if you need something. My final tip is to be open. Now, we've talked a lot about not getting the epidural, and I am here to tell you that you also need to be open that you might need something for pain. That could be a whiff of IV pain medication right as you get to, 7 centimeters because you're so tense. Sometimes just that IV pain medication can help your body relax and let that baby descend into the birth canal. Same thing, sometimes IV pain medication isn't enough and you need an epidural to help you relax and let that baby come down into the birth canal. It is important that you understand that an epidural is just a tool that you can use to help you during birth. It's fine if you want to avoid it, but don't think that it's evil or that you're a bad person if you got an epidural. I want you to keep your mind open to the options, but also be prepared and be very hopeful that you can manage your labor without pain management as well. Now, one of the things that catches a lot of people off guard is how annoying it is for us to futz with the monitors on your belly every once in a while. Now, there is a way to not have us do it that frequently. I have a whole video on wired versus wireless monitoring that you guys can check out. I think that can be another great way to try and avoid getting an epidural, but you need to understand the nuances behind it. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. And best of luck to you.